Hello, I am Dr. Dhiraj Sonawane. I am a spine specialist. So today I am going to educate you regarding non-scientific treatment which is inappropriate and doesn't have any medicines evidence to support it. So first of all is spine decompression. So there are some videos which goes viral for non-surgical spine decompression, which may happen by pulling the patients through leg or patient hanging through some bar, and spine will get decompressed and the nerves will get free. So this is a myth. This doesn't happen. So whenever the spine is put under some traction or under some forces, there is some decompression, lengthening which happen, but which will immediately go after patient lie down or go back to its normal physiological position. This is one. So there is nothing called as spine decompression which will happen non-surgically. Second thing is cracking. So most of us are seeing, if we have a neck pain patient or a back pain patient or patient with a sciatica or some underlying other issue which is not resolving, we go to a doctor, so-called doctor. I don't know whether they are doctors or no, or they can practice such a non-scientific thing just by putting some jerk or some forces and creating some cracking sound. Patient feels better. Yes, they might be feeling better, but that's not the treatment. Why? First of all, this cracking causes releasing of some endorphin, which is a hormone which causes temporary pain relief. Hence, we feel better after such cracking. Second thing, if you have underlying some major issue such as a disc which is pressing the nerve or the spinal cord, or we have underlying some infection, so with such forces, the diseased body or the weak disc may further get worsened and you may land up with paralysis or further injuring your spine. This is very important for you. And the third and most important thing, we are seeing such patients with a deformed spine or scoliosis or with big hump which has been pushed down by the cracking doctor, so-called doctor. So that deformed spine is not going to get corrected by pushing the spine, and it is not going to go back to its normal position just by a pressure for a few seconds. So this is not going to work. So don't go for this non-scientific treatment. Whoever advises you, go for a scientific, evidence-based, legal or qualified doctor. Visit the doctor and get your treatment or diagnosis right. Thank you very much.